Kemal said, I'll be speaking more on the billing end of month reporting, also the client communication between our clients. So obviously communication between UM and the client is a key factor in how the client performs. Usually the correlation between the responsiveness of the client and how well their collection rates are on their services they provide. It usually correlates based on how well the client is communicating with us. The different ways that we communicate here at UM with our clients are through client meetings, whether it be monthly, weekly, bi-weekly, face-to-face or virtual, quick base, email, and obviously direct calls from the client if they have any requests. At UM, we try to reach out as much as possible to all clients, no matter how unresponsive they are. We usually send emails or try to contact maybe the office manager directly if we haven't heard from them, or if they continue to miss meetings, we try to reach out, try to do the best we can on our end. And QuickBase is probably the most frequently used way we contact the clients, that and emailing as well. But we prefer the clients to use QuickBase because it's easier for the ARs, accounts receivable representatives to work through any accounts that they may have or any questions that they may have. And I have a slide here just with a snapshot of what it looks like. To send a request to a client, we're able to either send a request to a client asking for more information on a patient, or the client can send it to us asking us to look into a certain account.
So just to maybe take a step back, so we utilize two PM systems, practice management systems. They do have standard reporting, CPM and SPM. The reason we added QuickBase is because there are certain standard ways that we are actually communicating with our clients, and each specialty may need a different reporting, the forms and the way that we design them. The need is different. So the only way that we can actually make that efficient is taking this reporting to a next level. The next level is for us is QuickBase, and just want to make sure that that's kind of clear for our people.
Yeah, and we try to definitely reach out to the client to make sure that this is the main way we want to communicate. Like, we want to communicate through QuickBase, specifically for patients. And I mean, email is not bad, but it's not the most secure way, obviously. So QuickBase is a lot more secure on that end as well. Switching over a little bit to the end of the month. Another helpful tool that we can use to communicate with our clients is the end of month reports. We send this the first day of the following month to all of our clients, and it'll just display a summary of, it'll display basically just a summary of all the information that we have seen within that month. And I just have, like, on a slide some items that are included, such as the cover page, which is basically a summary of all the findings, denials, client-related or system-related, and also financial information, which the clients are obviously really paying attention to. And I think I have an example for each one. Yes. So first item I wanted to speak about was the cover page. So as I said, this displays a brief breakdown of the client's current status, includes the client name, specialty, and contact. Also, it includes the state of the AR section, which shows how long an average claim takes to get paid, which is our days in AR. And any issues or trends that UM is seeing. We'll also include that in the additional notes at the bottom, and I have, like, a example of one on the slides.
So one of the reasons for the end of month reporting, the way that we design that is actually going to the practice partners. It's not just going to the practice administrators, because we know that in our small and mid-sized practices, our client is the physicians who own the practices. So we wanted to make sure that when they receive information directly from us, we are not relying on anyone on their side, so that information is being sent to the client directly. So that way, if there are any issues, the only way that we can improve and catch any type of issues is if everyone is looking at it at the same level from different angles. So, and then I think that's important for a client to review their reports carefully, and then those are the reports that we discuss when we have our monthly meetings with them.
Yep, exactly. Yeah, and usually when this report goes out, whenever we have, at least on my end, whenever we have the next meeting, we usually go over the end of month reports and just break it down, try to make it easier to understand sometimes. And like you said, like the next topic I had was the denials reporting on the end of month report. So it'll show the amount of denials that we enter on UM side each month. And these are just insurance related. It can be either I think the majority of the denials are usually client preventable, at least for all my clients. And they are usually separated in categories of check-in and check-out. And I have an example on one of these slides with the client preventable summary, which breaks down basically the amount of denials that we're receiving per month, well, for a 3-month period, 3-month span. And we can use this report to report to the client on how well their progress has been coming on certain denials. Like, for instance, I have an example up where this client has issues with entering incorrect insurance information. So we can go month by month to see how well they're doing in that category. And I think this report, I use this on in every meeting. It's really helpful to see how well the staff is doing and if they're actually paying attention to what we're discussing in our meetings. Let me see here.
So one of the other important part of these reports, it actually communicates the days in AR, and then not only they see the days in AR, but we are also sharing the averages with other practices who are in the same specialty, so that they can compare themselves as well as the industry standards too. But I think days in AR is important for medical offices, and then when we are able to point out how to correct these issues, what's the best plan of action, the next step, those are all kind of summarized in one page with the support of all the detailed reports, right?
Yep, correct. And that was actually what I was going to talk about in the next slide. I had the report card, an example of a report card where we share the, like you said, the days in AR, the total charges, the outstanding balances over 90 days, the patient balances. So yeah, it breaks down pretty much the progress that we're seeing month to month. And obviously this is a helpful report for clients to see how well we're working and also how well they're doing as well, especially with some practices having large patient balances. Like maybe we'll have to make a decision on whether they have to send patients to collections or, so it's just a good report overall to just see how well the practice is doing in general.
Yep, absolutely.
Another financial report that we use that's included in the end of month report is the charges and payments, which I think every client wants to review this, at least in my meetings when I'm meeting with clients. And it just displays the total charges from the previous year and this current year. So I have an example of one showing just the total charges, total payments, and total adjustments breakdown by each month, and you can compare it compared to last year. I know that there were a lot of discrepancies when we were comparing certain years because of COVID, obviously. So it wasn't really a good comparison, but this report is helpful, at least within the year, to see how much, like if the client is consistently putting charges in on time, or if we're seeing a decline in payments. It's just a helpful report as well for providers to see. And the last report I had attached to this was also related to charging payments, but it was broken down by provider. And I know a lot of providers request this report because they just want to see the breakdown of, I guess, the productivity of the physicians that are associated with whatever client. So again, it just breaks down the total charges, payments for each provider. And this is more, I guess, definitely helpful for the, I guess, the main provider for those clients, just to see the production of their staff. But yeah, that was all I had. Kemal, I don't know if you had anything.
So one thing that we know, we get a lot of good feedbacks from our clients when we standardize reporting and communication, even if everything is not perfect, but being able to openly share everything, being transparent, builds the trust with our clients, and that's why they're happy with us and with our services, and we appreciate them, and I know they appreciate us. And Darren, thank you for joining us. So this was a good presentation, and I'm sure we'll have you in the next couple months again.
Of course. Thank you for having me.
Thank you.
Bye.